Um, so we didn't do an international comparison, but in the United States, because of our very, very high labor force participation among older people, and their education levels, we found that there was disproportionate numbers of older workers compared to other occupations on what we called the front line. Okay, good, good, good. That was just an introduction, that we had a lot of older people in caregiving and other kinds of retail and other kinds of service work, people who could not work remote. And the other odd thing about the United States is that paid sick leave is voluntary on part of the employer. So those two combinations were quite lethal. Not only could older workers not go home and work remote, but they were much more vulnerable to the illness, as we all know now. When we first did this research, people didn't know why. Now we know why. But here we had a bunch of older people right on the front lines, and there was no vaccine. And they did not have any way to stay home if they had sniffles or anything else. So they were spreading the disease and also exposing themselves. Why is this important in the United States? It's important because our peculiar labor market and our demographics are such that older workers are one of the most important groups in our labor market. For instance, from 2000 to 2019, most of the jobs, the vast majority of jobs, were filled by workers over 55. So 18 million jobs were filled by workers over 55, and we only created 21 million jobs during that period of time. Going forward, it changes every year, but it looks like older workers over 55 will be half of the growth, or sometimes more than half of the growth. All OECD countries, except the United States and Korea, and we also compare the non-OECD and G20 countries, have statutory paid leave, but the United States does not. And what's fascinating, and no one knew this in our field until we lifted it up, is that our Bureau of Labor Statistics does not collect data on who has paid sick leave and who doesn't. It's not viewed by the US government statistical agencies as a worker benefit. Instead, it's the Centers for Disease Control that collects data on who has sick leave, because it's not considered by the Centers for Disease Control a private good that benefits the individual worker, as another kind of employee benefit would, but that sick leave is a public good because it helps workers stay home and not spread infectious illnesses. So the public good aspect of sick leave is the reason why the Centers for Disease Control goes out of their way to collect it, where the US labor market doesn't. This reflects the weak bargaining power of US workers. I am going to hand it over, our findings, over to Ida Farman, who is at the University of California at Berkeley.
Hi, thank you so much, Teresa. So yes, for the main findings, we decided to focus on occupations were in the front lines during the COVID-19 pandemic. So people who were deemed as essential workers and couldn't work remotely and were obligated to show up for work. And then we looked at what is the magnitude of the older labor force in these occupations and how many have access to paid sick leave. So these select frontline occupations were the healthcare support occupations, which includes home health cares and other personal care aides, plus other occupations, lower paid occupations in the healthcare industry. More than 1 million workers were over the age of 50 in this occupation. They constituted 29% of the workforce in this occupation. 50% of the people over 50 who were employed in this occupation did not have paid sick leave, compared to 40% of all younger workers. The second frontline occupation is building and grounds cleaning and maintenance occupations, which were very essential during the pandemic. This is a large group of these workers are older workers, so they employ more than 2 million people over 50 years old. And they constitute 42% of the workforce in that occupation. A very high share of 58% of these older workers did not have access to paid sick leave. That was also true for younger employees in that occupation. Then the last one is the transportation and material moving occupation, which a lot of people and the economy really relied on them during the pandemic to deliver packages and provide a lot of essential work. Again, it's a very big occupation with more than 3.2 million older workers employed in it, which constitutes 34% of the whole workforce in that occupation. And more than half of them did not have access to paid sick leave, which is even higher than the younger workers who were occupied in that occupation in the pandemic years. And in total, as Teresa mentioned, workers over 50 constitute a large portion of the US workforce, around 1/3. This is a little bit older. This number has even grown higher today. And still 40% of them over the whole workforce did not have access to paid sick leave.
This is part of a larger project about the bargaining power of older workers. And since older workers are such a big part of the US labor force, it spills over to an indicator of the bargaining power of all workers in the United States. So this is a fractal of our work on the monopsony control over older workers, which is getting worse because their pension options have declined so much that more and more people at older and older ages find themselves in the labor market and somewhat beholden to the terms of the employment conditions that the employer offers. So this is just a fractal of the consequences of older workers having to work and not having an employee benefit that other countries take for granted, like paid sick leave. Here are some of the key takeaways. You can go ahead, Ida.
So older workers are disproportionately represented in care and other service professions on the front lines that were responding to the COVID-19. Another aspect of this research was that if more than 1/4 of the older workers provided unpaid elder care, which make things even riskier because they were exposed to disease. They couldn't take time off if they felt sick. And that meant also exposing their spouses or other older people that were taken care of. So this was just putting even older and maybe sicker older people in danger of contracting COVID-19. Over the whole workforce, 40% of older workers do not have access to paid sick leave. And this really ties into the lack of union density in the US, because unions are one of the major pathways of ensuring labor standards. And over time, the share of unionized workers in the US have really eroded. So only 13% of older workers were union members in 2019. In absence of unions, really federal legislation should mandate paid sick leave for all workers, because of the, if only for public health improvement.
Yeah. There's, as we know, there's been a slew of data. If you need to see those slides, let me know. There's been a slew of studies to ask what were the compositional, uh, how could we decompose the deaths, from COVID? Many people have discovered that not opening the schools did not have an impact on the death rate. So that was a mistake. That was a policy lesson that we learned, is keep the schools open. We learned that housing density, people living together, was a very big cause, but not the subways, or not public transportation. So there were a lot of lessons learned. There hasn't been a study on what the lack of sick leave did to spread the disease. So we can't conclude that what we implied here actually happened to be true, but we do know that housing density had a big effect. And if you had a worker in that in that occupation, it certainly was a problem for nursing homes. The nursing home workers having to go back and forth did cause deaths in nursing homes, but we don't know about the other knockoff effects. So that was shorter than we thought it would be, but we're happy to talk about any other aspects of the research.